you want to open. Yeah.
Hicks Hudson, you start.
Okay. Good afternoon, everyone. Welcome to our October Maternal Health Caucus meeting, and we're excited to be here, and we thank you all for being here. My co-convener, Senator Ingram, is also on the line, and I'm going to kick it over to her in just a second. But we just wanted to say thank you all for coming. The struggle is real, as you know. While there have been some things that are happening here at the state, we still are dealing with the question about how do we ensure that babies, are born healthy and mothers are able to go through a childbirth process and have a healthy child, and be able to get out on the other side. And so part of what we've asked two of our state partners to come and talk about what they have been doing. I think many of you know that there was legislation done on the last General Assembly to expand and to beef up the whole idea of having part with in the Department of Nursing to have doulas, and we all know what doulas are, and so this was something that we in the legislature worked on and we're now able to hear from the department or the Board of Nursing and others about how this is going on. So Senator Ingram, who also is going to give you a few words of welcome before our guests to begin to speak.
Thank you, Senator. I'm not going to keep you very, very brief. Thank you for being here. And I'm just going to kick it back to Deja, and you guys we'll take it from there. I'll have some words to say before we get off, but thank you so much for being here today.
Thank you, Senator Hicks Hudson and Senator Ingram, and thanks everyone who's on the call today. Today we're joined by some folks from the Ohio Board of Nursing. We have Jack, who is our legislative liaison with the board, and then we're going to have Lisa, who works with the various advisory groups at the Board of Nursing, and specifically, I know we're going to be talking about the Dual Advisory Board and just kind of what some updates on that and where we're at with that right now. So thank you guys for being here.
Yeah, thank you very much. And yeah, Lisa's really our expert in this area, so I will kind of her. Really appreciate the opportunity to talk with you all today. My name is Jack, and I do mostly the legislative side of things. So anything that impacts the Nurse Practice Act in the Ohio Revised Code, that's what we try to stay on top of here at the Nursing Board. I know doulas have been certified in Ohio for the last going on 2 years now. I believe it was House Bill 110, I think, in the budget bill last General Assembly. I believe that created the doula certification here underneath the Board of Nursing. So ever since then, we've been overseeing the doula advisory group and beginning to certify doulas. So with that, I'll just turn it over to Lisa, as she knows much more about it than I do.
Well, thank you, Jack. Let me share my screen here. I hope I can live up to the hype here. Okay, great. Can you see my screen? My presentation? Okay, good. Thank you, Senator Ingram and Senator Hicks Hudson, and hello, everybody. Thank you for the opportunity to speak today on behalf of the Ohio Board of Nursing. My name is Lisa Hashimian, and I serve as practice administrator for the board. And as you see, I'm joined today by Jack Brubaker, the board's legislative liaison. And I'm here today to provide an update on the state of Ohio's certified doula program. And to begin with a brief refresher, which you may or may not know, doulas are not required to be certified by the Board of Nursing to provide services in Ohio. However, certification is required for doulas who wish to seek Medicaid reimbursement for their services. The state of Ohio certifies doulas as part of a broader initiative to improve maternal and infant health outcomes. The certification process supports efforts to reduce infant mortality, address health disparities, and promote healthy families by making doula care more accessible, particularly for individuals covered by Medicaid. And I've been asked to provide data regarding state of Ohio certified doulas and information about the doula advisory group, which I'll now share with you. So we currently have 204 active state of Ohio certified doulas, and that number is current as of Monday, October 20th. In addition, we have 113 doula applications in various stages, of which 55 are in review status, which means the applicant submitted the application but did not submit one or more of the required documents. Some of the most common missing documents are criminal record checks, documentation of doula certification or education, and/or documentation that the applicant qualifies for the fee waiver. I believe we asked for tax documents for that. In addition, 54 are in pending status, which means the applicant started the application but did not complete the application. And 4 are in generate fee status, which means the applicant did not submit payment. And I want to clarify the 54 pending applicants, they started the application but did not submit it yet. So 55 are in the furthest part of the application process, and the others have not completed it yet. So here is a map of the counties that are represented by state of Ohio certified doulas, which are highlighted in the blue. And here's the listing of the number of doulas by county. The highest amount are in Cuyahoga County, which is the Cleveland area, with 83 doulas, followed by Franklin County, which is the greater Columbus area, Hamilton County, which is Cincinnati, and Summit County, which is the Youngstown area, followed by the other counties listed. We also have a few counties that have 2 doulas each: Claremont, Erie, Mahoning, Warren, Putnam, Portage, and Fairfield counties. And then the following counties have 1 doula each, which is Richland, Ashland, Ashtabula, Noble, Auglaize, Allen, Wood, Athens, Shelby, Meigs, Brown, and Muskingum and Lorain County. And also 3 state of Ohio certified doulas did not report a county location. And as you can see, the doulas are clustered along the population centers of the state. So I'll give you a moment to look at that.
And we can also send you these graphics too, if you know.
Yes.
The senator's office would like that.
Certainly. We also have doulas that are certified in Ohio but are located out of state, so their address of record is out of state. We have 2 in Michigan, 1 in New Jersey, 1 in Texas, and 1 in Kentucky. So Michigan and Kentucky make sense since they are contiguous to Ohio. Not sure about the New Jersey and Texas ones, but they are certified in Ohio. Okay, and so let me talk some about the doula advisory group. So the doula advisory group is a very active group. It was established in October 2023 when the doula certification statutes went into effect. And the charge of the doula advisory group is to provide general advice, guidance, and recommendations to the Board of Nursing regarding doula certification and the adoption of rules. And also advise the board on requirements for training, which include training on racial bias, health disparities, and cultural competency as a condition on initial certification and certificate renewal, as well as the requirements and standards of practice for state of Ohio certified doulas. The group also advises the Board of Nursing regarding individuals seeking to be eligible for Medicaid reimbursement as certified doulas, and provide general advice, guidance, and recommendations to the Department of Medicaid regarding Medicaid coverage of doula services. So that is the charge of the group. So the membership of the group, there are 16 members plus the chair, who is our board president, and it's the board's largest advisory group. As you can see, the membership comprises a broad spectrum of individuals and organizations that have a vested interest in advancing maternal and infant health outcomes. And that includes, we have representatives from the Ohio Department of Health, Commission on Minority Health. We have 2 consumer members. We have 3 representatives that represent the health of communities most impacted by negative maternal and health concerns, 5 doulas that have active current valid certification from doula certification organizations, 1 physician, 1 public health official, and 1 representative of a doula certification program or organization established in Ohio. And I do want to clarify the doula certification mentioned in the group members and elsewhere is different than the state of Ohio certification. So the state of Ohio certification means doulas that are certified by the Board of Nursing, and certified doulas are doulas that hold certification from another organization. It could be national or locally certified doulas. And I just want to clarify that because it can be a little confusing. In 2024, the group met monthly to establish the regulatory framework, including establishing the administrative rules of Chapter 4723-24 of the Ohio Administrative Code for doula certification, and outlines the requirements for certification and practice as a doula, as a certified doula in Ohio. In 2025, the advisory group met 5 times, which includes the next scheduled meeting on December 10th. And then in 2026, 4 meetings are planned. And many of the meetings in 2026 and the last one on December 10th will be held virtually, which is new for this group and new for our advisory group. So we have been allowed to now hold virtual meetings, which the public can access still. And they have been going very well. So that the first one will be the November 10th meeting for the doula group. Since the heavy work of establishing the administrative rules have been completed, the group has settled into a meeting schedule that's more consistent with the board's other 6 other advisory groups. And just as an FYI, the 6 other advisory groups that the board has includes the Nursing Education Advisory Group, the Advisory Group for Community Health Workers, Dialysis Technician Training Programs, Continuing Education, APRNs, and an advisory group for rules making. And Jack and I are involved in all of those groups and attend them. So there is a report mandated by the Ohio Revised Code that the Board of Nursing will be required to submit in April 2026 to the General Assembly and annually thereafter, which the Doula Advisory Group is assisting in the coordination and development of the report. The report will provide information on the number of pregnant women and infants served, the number and types of doula services provided, outcome metrics, including maternal and infant health outcomes. The information will be derived from data furnished to the board by the Ohio Department of Medicaid. This report will contribute valuable data to the body of knowledge and research into maternal and infant health outcomes in Ohio. And just to provide some general information provided by Medicaid to the doula advisory group in September of this year, at that time there was about 120, I think it was like 119 doulas that are certified as individual providers that have billed Medicaid for doula services. And we actually have just asked for an update on how many currently they've had doulas are certified with Medicaid and how many have been billing for Medicaid services. And also Medicaid is planning to attend our December 10th meeting and to provide additional information regarding the data they're collecting. So that should give us a better idea of the metrics that we will be looking at, the specific metrics in the details of them that's being gathered by Medicaid. So we're excited to see this report. I think it's going to contribute a lot of really good information. And the doula advisory group currently has open positions. There is one consumer member position open. There are 3 positions for doulas with current valid certification, and 1 public health official who may be a physician, nurse, or social worker. Applications are posted on the board's website. If you go to the homepage and look under news and events, I think it's the 3rd or 4th event down, is a link to the applications, which are due no later than November 3rd. And it's a posting for new members of all the board's advisory groups, including the doulas, and they will be appointed at the board's November 19th and 20th meeting, and this will be for the 2026 sessions of the advisory groups. And I just want to add for the advisory groups that the board just very recently migrated to a new website, a couple weeks ago actually, and several members of the doula advisory group were instrumental in user testing for the new website, which the board greatly appreciates their assistance. It was very valuable. And I just want to say that first to say thank you to them and also to show how active and involved they are with the board. So that is all the information I have for you today. And I would like to know what questions you have for myself or Jack.
Thank you for that. I'm certain that there are questions that folks have, but one of the ones I want to ask right now is I have a couple actually, but the one I'll ask first, because you mentioned the openings for the advisory boards. How do you send that information out to anyone, or is it just that they have to find it if they happen to be looking at your website?
No, first it is posted on the front page of the website, but when applications are open, so they were posted at the beginning of October and they're up there for a month or till it closes November 3rd, that an email goes out to all licensees, certificate holders, and stakeholders about the open applications.
Okay. Okay, because I was going to say maybe we could share that too, because in our offices, we get representatives from those organizations all the time for various reasons, questions or for advocacy days or things of that nature. So maybe we can get some of that information out too.
Yeah, and that's wonderful. And again, it's for all the advisory groups. I think all the groups except the APRN has openings. And it's because their cycle's a little different. Their openings come up in May instead of November. But yes, certainly. And I think the email, so we have about over 300,000 or close to 300,000 licensed nurses and certificate holders in Ohio. So that email does go out to quite a few people, but the more people it gets out to, the better.
Okay.
These groups are very valuable. I'm sorry.
No, you're good. Thank you. And the next thing I want to say, and I think Jack talked about this, that we're going to get a copy of that. Make sure our offices get a copy of the presentation that you just did.
Oh, certainly.
Senator, I was just going to jump in to remind everybody on the call that if you do have questions for the presenters or for the senators, please feel free to put those questions in the Q&A. If you're on your phone, it's going to be at the top of the phone. And if you're on a computer, it's going to be at the bottom. So me and Amber, we are looking at those Q&As and can read them off and have whomever, respond to those. So Amber, I'll go ahead and read maybe the first one here that we have from some of our guests in the audience. So someone had asked, how often will doulas be getting recertified?
So it is a 2-year certification. And their renewals, Jack, do you remember if they're renewed on the odd or even number years?
I do not know off the top of my head. I'll have to look in the statute and see what it says.
Yeah. So yeah, it is good for 2 years.
And I'll also make mention too, as we're going through these questions and even this presentation, that we always record these meetings. So, for folks who want to look back or, these questions were answered and they didn't have a chance to write it down, the recording will be posted on the Ohio Senate Democrats YouTube page. So you can always feel free to go back and watch the video, and hopefully we'll be able to send it out to everyone. Once we have the final recording after the meeting, we can send that to folks too. So that they can reference that as well. We have quite a few questions, so I'm glad we had a lot of time here at the end.
Good.
The next question says, how is the data being collected for the General Assembly?
It is coming from Medicaid. So we are pulling together the report and the data is being collected by Medicaid. So it's actually their data that we're working together to report. So, and I believe they're using, billing information that they're getting.
Cambridge, do you want to read a few if you would like?
Actually, I was just going through and typing the answers so I can have them in the chat.
Okay, perfect. So I'll go ahead and read the next one.
Go ahead and.
Okay, so we have another question here. It says, how is the Board of Nursing handling the rule that now states that doulas have to have been in business for 3 years and have 5 clients for the doulas who are pending their certification?
So there are different paths to becoming a doula. One is through education and certification. And then the other path is to have, if you don't have the education and certification, you have to have 3 years experience, which includes 5 clients within those 3 years. So that information, if you're going based on experience, is submitted with the at the time of the application, and it's reviewed to the board or by the board at the time of the application process.
Thank you. I'll go ahead and read the next one here. It says, is the goal to have doulas in all 88 counties? And I will add too, I know during the budget, the senators had worked to, there's language that was submitted to limit the expansion of doulas across the state, as well as capping the reimbursement. So this person's asking, is the goal to be able to have this in all 88 counties?
I would say certainly for maternal and infant outcomes, we would certainly want them in all 88 counties. As you can see, I showed by the map that they are clustered around population centers, and it looks like they're not spread out very evenly through more rural areas. So that's certainly a need. And I think the data, hopefully the data that we'll be receiving from Medicaid with the new report will help support and show the need for more doulas more widespread throughout Ohio.
Exactly. Sorry, I'm just going through all these, if that's
Oh, that's fine.
making sure we get everyone's questions answered. So we had someone ask, are doulas trained to discuss or demonstrate infant safe sleep practices with new mothers?
I believe they are. We don't regulate the training of doulas, but I believe that's standard protocol and training anybody dealing with new mothers. You know, that's a very big push to discuss safe sleeping practices, just like good nutrition and other things that they would be discussing with their clients.
Thank you.
Mhm.
Let's see here. We had someone asking just more on the accessibility of finding meeting notes from previous advisory groups. So they're wondering just how or if the public can access the previous meeting notes from the doula advisory group if that's posted somewhere.
Sure. So that's all public information, and those meetings are open to the public. I just want to say, especially with them going to a more virtual format, they're more accessible. Prior to the meeting, the agenda is posted on the board's website on the front page, and there's a link to the meeting when they're virtual, or if they are in person, it will have the location and the time of the meeting, and anybody's welcome to attend. But the meeting minutes are also public record. You can email board@nursing.ohio.gov, or if you email practice@nursing.ohio.gov, that's up on the screen. You can request them and they'll be submitted to you. You don't even have to say who you are for a public records request or why you want them. You just have to give us enough information so that we know what you're asking for, and then they'll be sent to you.
Perfect. And as we're answering these questions, just to reiterate, we're trying to take notes on these responses so that you all on the call can have these questions answered and reference those when you're looking back and trying to navigate whether it's their webpage or just information about the doula advisory group and the work that they're doing. Let me see
We
here.
appreciate that.
Let's see. So we had someone ask if doulas are able to attend the Black Maternal Health Caucus meetings in the future, and I just will answer that to everybody. Of course, everyone's invited to attend these meetings. These meetings are also open to the public. We share them ourselves with different distribution lists that we've created, whether it's with stakeholders, but also to our constituents and also elected officials and things of that nature. So please always feel free to share the Zoom link. We have them each month. So everyone's always welcome to attend and listen in on these meetings, and you can share the link with whomever you need to. I'm going to scroll down here. Let's see. Jackie Brewer is just saying thank you to the work that's been done to get doulas certified and get them reimbursed by Medicaid. They're a nurse midwife and working frequently with doulas, just saying that they appreciate the services and the effort to be able to include them and get some Medicaid reimbursement to them as well. Let's see. So we have a question that says, is there any intention to work with other doula groups across the state for additional data regarding non-Medicaid?
Well, for the Board of Nursing, our scope's limited to state of Ohio certified doulas, which to be certified by, you have to be certified by the board to bill Medicaid. And it's in statute in the law for us to collect data from Medicaid from that. we would certainly, we certainly welcome input from other groups, especially with the advisory group. As you see, we said representatives from many groups, but currently we don't have a charge to collect data from other groups. But I'm hoping, my hope is the data and the report we collect, it'd be a good foundation and starting point for other groups to use as a framework to build on for their own with their own data and information.
Plus, I think you have groups, this is Senator Ingram. Plus, you have groups that already collect their own data, such as Cradle Daddy, Queens Village. And so working from that to the person who asked the question, maybe you can send some information to our office and let us know what we're trying to get to on that. Because I think that you're right. Rather than doing this as individual groups, and then of course the state has their certification, et cetera. If that is being done, even with midwives and our birthing centers, et cetera, then we need to know what we're doing all over, especially when we're talking about being in all 88 counties at this point.
Thank you. Say, hopefully this will be the building block to
Right.
add more information.
Going back to the question asked earlier about the different requirements to become a certified doula, I just have a follow-up for that from that person, just trying to clarify a little further. And it says, she says, why is there confusion with the experience certification for doulas? She's hearing from doulas that there are doulas who came in through the experience certification that were seen as 3 years of experience or 5 clients. Is this wrong? So is it 3 years of experience or 5 clients, or there's just kind of some confusion around that, qualification there?
My understanding, so it is 3 years and with 5 clients. It has 3 years and 5 clients, not or. And I was not involved intimately with the process at the beginning, and Jack might have a little more insight into this. But my understanding is when they were establishing the rules, it was a discussion within the group how to look at that requirement and how to word that requirement. So I think there was probably some discussion going back and forth about the pros and cons of either ways. But I know the group did vote on and accept the 5 years or the 3 years and 5 clients. And Jack, I don't know if you were involved with that process at the beginning and might have a little more insight into it.
Yeah, sorry, I wasn't involved in the rulemaking process at all, but I know that it did go through the doula advisory group and then also through our rules advisory group before that rule package was approved by all of our board members as well, and then sent, to CSI and to JCAR, and then underwent the full rule review process through the legislature. So, and I don't believe there was any opposition. Like Lisa said, it was fully accepted by the advisory group at the time. So yeah, I don't really. We could ask some of our other staff who are more involved in the rulemaking back when that was going through a couple years ago. But yeah, that's really all I got.
And I would like to say part of the rulemaking process is there's ample opportunity for public comment on any of the rules, and all the comments that are received during the rulemaking process are reviewed and considered by the board.
Thank you. I'm going to keep through here.
Mm-hmm.
And again, please, folks, we still have a little time, so if there's some other questions that you might have that maybe haven't been asked or that you would like to share, please feel free to put those in the Q&A. You can put them at the top of your phone or at the bottom of your screen on a computer. Let me see here. So let's see. So I'm going to put these two questions kind of together. They're coming from the same person. The first question is, when will the current amount of reimbursement, like the reimbursement amount that they're currently getting, be up for any renegotiation? And then they go on to ask if the doula reimbursement has been affected by any of the Medicaid cuts, if that's something you all can speak to.
That's more of a Medicaid question because we don't deal with the billing and reimbursement fees for the doulas. Jack, do you have any insight into that? Any additional insight?
Yeah, I don't think we could really speak with accuracy into that without getting Medicaid's opinion.
And you all said that Medicaid is going to be, though, at the December 10th meeting to talk basically about this kind of conversation more, maybe more in depth, or?
Yes, in particular about the data they're collecting for our report that's due in April 2026.
Okay. So maybe just talking with them, they would be able to maybe answer that question
Mm-hmm.
or so. Let's see. Let's see. So it says here that do doulas have mandatory educational trainings for certification and or recertification by the Board of Nursing, like things like child abuse training, how to identify it, or like domestic violence? Is that something that the Board of Nursing mandates when they're going to become certified or recertified?
They do have continuing education requirements that specifies certain things, and I'm sorry I don't have them in front of me, but there are, but to become certified, you don't have to have the education component. You can do it from experience. But if you to become certified by the Board of Nursing, but if you are nationally or locally certified by a certifying organization for doulas, they would have their own education requirements.
Thank you. And then another question is whether the public can find the availability of doulas in their area to act. Let me see here. Like, is there somewhere where like this information is like readily available if like someone's trying to find a doula in their area, like how you can find a doctor that takes like your insurance? Is there something like a one-stop shop where people can look to see if there's any doulas in their area?
That's a wonderful question. I do know from the insurance perspective, if you're part Medicaid or managed care plan through Medicaid, you can contact them directly, your provider directly, your insurance provider, and they can provide that information to you. I don't know. I do know the group has discussed having that information available as a one-stop shop. But I don't know that like a public registry per se of doulas in the area is up and running yet. And Jack, are you familiar with that? So Jack's been involved with the advisory group longer than I have, so he may have some additional insight on that.
Yeah, there's nothing active right now that we have available to besides just our internal licensure data and certification data. It's a wonderful idea, though. Maybe something we could look at in the future.
Mm-hmm.
So basically, if folks like, just like you look up for your doctor with your insurance, like you can kind of do
Right.
through your like whatever service you're using to find what doctors take, like your insurance, that maybe applies with like same for a doula. However, there not necessarily isn't like list on the Board of Nursing or something that list maybe like all the current registered doulas.
Yeah, and I would suggest speaking to your doctor if they have doulas they've worked with and recommend, friends, family that have used doula services, if they are, know any doulas or familiar with doulas that they recommend.
Yeah. So I think this is one of our last questions, but folks still feel free if you have anything else you'd like to ask. But this is One of our last questions I have here is, of the 204 active certified doulas, how many were certified under education and certification pathway, and how many were certified under experience in clients?
That is a good question, and I don't have that data in front of me. I do know there was a conversation that we had that we have not anybody that has submitted the experience and client list that meets the requirements. We have not denied any of those applications if they meet the rest of the requirements. So, but percentage wise, I don't know exactly, or, you know, numbers, how many do it based on education experience or experience in it, or education and certification. Again, I'll throw this back to Jack to see if he has any additional information about that.
Yeah, I would just say, you know, send an email to our practice at nursing.ohio.gov, and we could have some of our certification and licensure folks who compile that data look into that question.
Thank you for that. We did have sorry, I think I skipped over a question, but you might have touched on this, but someone was just asking how the advisor. So maybe more on like if you all can talk to like the collection of the data, like with that report coming out, like how, or like what is that looking like the methods of the collecting that data, if there's anything you can maybe expand on in that regard.
I know, again, because it's coming from Medicaid.
Oh.
Hopefully we'll find out more in December. I know, you know, the law has requirements of data that we have to provide, but what exactly that looks like, I think a lot of it's going to come from their billing data for Medicaid.
Okay, right. And just so everyone, just to put it out there again, December 10th is when the Department of Medicaid will be on the call to be able to talk about that data collection, on the call as in the dual advisory group meeting.
Yeah.
And that will be virtual, correct, as well?
Correct. That is the plan at this time, yes.
Perfect. So we can also, you know, once that is set up too, we can share it with our, you know, the folks who are on this call and our folks we regularly engage with through the Black Maternal Health Caucus. You know, if that's good, we can share that link when that comes out to everybody. So hopefully they can get on here from the department as well.
And I'm sorry, I just wanted to jump in. I'm not sure if I missed it. Did we get an answer to what the process is to recertify after 2 years?
You have to submit an application with the Board of Nursing. You have continuing education you have to meet. There's an application fee, but it can be waived based on income requirements as well. And it's similar, all certificate holders with the board has a similar process for that. Yeah. Actually, licensees too, they all are on 2-year cycles of renewal. It's either on the odd number or even number years. And it's all done electronically.
Senators, I don't know if you all have any questions yourselves as well. I know I've gotten through the list that our participants have submitted to the Q&A, and thank you, Lisa and Jack, so much for your thoughtful responses and answers to their questions. But Senators, I don't know if you want to add anything or have questions as well.
No, I don't have any questions, but I also want to thank the presenters for providing really some great information for us, and just seeing what that information will be in the report from Medicaid. And I hope it's more than just numbers, but really some things that we can use to build upon this program and to expand it. But I want to say thank you to both of you for being here and being available to give us an update on what's going on with this legislation in practice.
Thank you. It's been a pleasure.
Thank you. Thanks, Jack. Thanks, Lisa, for presenting today. And of course, we will follow up with some of this information.
Mhm.
Okay, because if you recall, the reason you have the advisory committee, the doula advisory committee, as well as being with the board of nursing, was the whole conversation about how doulas function in the first place. And so
Mhm.
there was some heartburn in the beginning as far as what the nursing board wanted and where we needed to be. And we still have to resolve those issues as to certification and the question the person asked about experience or education is something
Mhm.
that needs to be addressed. And which is why I made the comment earlier about being on the same page with a lot of this stuff, because Queens Village has chapters, or they have groups that function in Texas. So when you said there's a doula certified in Ohio that's in Texas, they actually have groups that are in different parts of the country.
Oh, yeah.
So we will need to be looking at that too. And it'll be maybe like one of those compacts that Senator Robner always has, which gets us to
Mhm.
of doulas, who
Yeah.
knows? But
Right.
that needs to be the
Yeah.
conversation, especially when it comes about reimbursement and Medicaid and the numbers that they're.
Mhm.
So hopefully they'll be able to clarify some of that additionally. And I'm glad that we finally got to somewhere where the advisory board got to some rules that were put through, but we want to make sure that they're addressing what the folks who've been doing this work for a lot longer than the advisory group existed, and making sure that we're all coordinated and the outcomes, making sure that we're taking care of those people who need that service. So thank you very much for being here, and thanks for the folks being on the call. And I'm going to figure this out, or Deja, you and Amber are going to, our aides are going to figure this out as to how we're going to allow people to ask their own questions, because there's got to be a way. Sometimes they may want to clarify it themselves,
Mhm.
and that's the important thing about that. So I appreciate the being able to put it in the chat, but sometimes I want to go, but wait a minute, that's not what I meant. So that's something we'll work on. And here again, I appreciate everybody being there. And Senator Hicks Hudson, if you want to take us out, then that's great. You're on something.
You're on mute, sir.
We can't hear you if you're meaning for us to hear you.
Yeah, I was trying to get off since you talked about the technical. Trying to find the unmute button. I don't really have anything else to add except that I'm so grateful for everyone that was on this call, and also for the information, because as we know, information is power. And then, as I said earlier, it can help us to form better legislation as we move forward in this space, to try to make sure that not only Black babies and brown babies, but all babies are born healthy, and that all moms, whether they're Black, brown, or white, are able to survive pregnancy and childbirth and get through postpartum, pre and post. So thank you all for being here, and look forward to seeing you in December, if not sooner. Have a great day.
Thank you.
Thank you, senators.
Yes. And thank you to our staff, because these
Thank
young
you.
women are the
Thank you, Dave.
lion's share.
My pleasure. Thanks for everyone for being here today.
Thank
Thank you,
you.
Deja.
Bye-bye.
Thank you. Have a good one.
Bye.